Hi, my name is Norm Van Lunsford, and today I'm going to be talking about the COVID-19 response in Iceland. So the reason I chose Iceland is because I know it's a small country, it's an island with a very small population. Um, they have a universal healthcare system, and I haven't heard a lot about them in media, and they also have only one international airport. And I know these things um, give Iceland an advantage to being able to control COVID cases and the spread of COVID. And so I've actually also was very interested because I used to play this app called Plague Inc. that allows you to release a virus into the world on this app, and you can design it, and your goal is to infect all the countries, and it's always very hard to infect Iceland. So I was wondering if my research could clarify that and help me with my game. Um, but Iceland, their demographics, um, there's about 360,000 people in Iceland, which is a little bit larger, about 20,000 people larger than New Orleans, Louisiana. And about 91% of Iceland's residents are Icelandic citizens or were born there, and about 15% are foreign born. And 99% of the nation's inhabitants live in urban areas or localities with populations greater than 200. Um, in 2016, this is the breakdown of religion. There's about 71% who belong to the Evangelical Lutheran Church of Iceland, and the next largest group was with about 19% were people who didn't have any religious affiliation. Economically, Iceland has the fifth highest GDP in Europe, and the average income is about 60,000 US dollars, which has increased from the past year about 6.7%. The at-risk poverty rate is 9%, which is lower than Nordic countries, which is the average is about 12%. They have slightly more men than women in Iceland, just barely 1.1 to 1 is the ratio. And the current state of COVID in Iceland, there's about 1,800 confirmed infections. There have only been about 10 deaths. Right now, this has been pulled from a website called the Iceland Review. And so this is updated every night at midnight. And as of right now, there are about 3 people in isolation and 757 people in quarantine. But nobody's being hospitalized, nobody's in intensive care. Things are very much under control. So here's their timeline. Before they even saw their first case on February 28th, they were already testing high-risk groups January 31st. And then March 13th, testing was open to the general public about 2 weeks after they saw their first confirmed case. March 16th, we began to see restrictions on social gatherings. Gatherings more than 100 people were banned, and they started to encourage social distancing of about 2 meters, which is our 6 feet. Universities and colleges were closed, but primary schools stayed open. And March 19th, all travel outside Iceland was designated high risk, and those entering Iceland had to quarantine for 14 days. March 24th, we see the gathering sizes restricted to 20 people, and there was a ban put on nursing home and hospital visitations. April 1st, COVID cases had been stable since March 13th, and by May 25th, which is today, we begin to see the loosening of COVID-19 restrictions, and gatherings of up to 200 people were allowed, or are going to be allowed. And June 5th, they plan on loosening travel restrictions for tourism. So compared to the US, January 20th, we announced our first case, which is earlier than Iceland, and we still responded much slower. We had not been doing any testing at this point. January 30th, these highlighted January 30th and February 10th through March 2nd, Trump was still hosting rallies, explaining how great we were handling the COVID spread, but he was having gatherings of thousands of people. February 2nd, we restricted entry to the US from China, which is after about 45 other countries had already restricted entry. and we were still making exceptions for hundreds of thousands of people. February 13th, Secretary and Czar of the, sorry, my cat, Secretary and Czar of the Health and Human Services, wanted to establish a surveillance program. He was saying that the government was going to be establishing a surveillance program in 5 cities, but this was delayed for weeks. And then on March 13th, President Trump declared a national emergency. And then March 16th, we see that social distancing guidelines were put into place. But our social distancing occurred about 2 months after our first case, while in Iceland, social distancing measures were put into place about 2 weeks after they saw their first case. March 23rd through 27th, hospitals began facing severe shortages of testing materials and PPE, which Iceland didn't experience because they put such heavy emphasis on surveillance and prevention, unlike the US. And then April 6th, deaths from COVID-19 became the leading cause of death in the US. So sorry. April 12th, the US conducted at this point, they'd only conducted about 2 million tests, which is about 7,600 out of 1 million of our population, while in Iceland at this exact moment, they'd already tested about 100,000 per million. So that's 7,600 versus 100,000 per million. And then April 12th, I already said that, April 16th, President Trump began announcing his guidelines for opening America back up again, which is what we're in the process of doing, while we're still seeing cases on the rise. Iceland, they're beginning to open back up, but they've completely gotten their cases under control. So here, some health system capacity differences. Iceland, they have about 362 physicians per 100,000, and they have about 3.06 hospital beds per 1,000, while the US only has about 295 physicians per 100,000 and 2.77 hospital beds per 1,000. And here is a graphic from that same website, the Iceland Review, that showed the number of hospitalized patients. The orange line is the total number, and the blue line is the number of people in the ICU. But careful to look over here at these numbers, because you see at their peak, only about 45 people were being hospitalized, and only about 12 were in the ICU on their peak date there. And so their response was heavily focused on surveillance and testing and tracking of cases. They tested about 10% of their population, and they began testing even before they saw their first case. Testing is free to everyone, and they plan on keeping it free for when they open back up in June for tourists. And they used an app that traced social interactions, and it was downloaded by about 38% of their population, which was exciting, because we have a lot of apps that are currently in progress by different countries and different companies to track the spread of this disease. But it's said that this app didn't prove very useful or effective. They just used other methods that were more effective. And so it doesn't look very good that other countries will have more success than such a small, cohesive country as Iceland. And they had limitations on the size of gatherings, and they had a mixture of social distancing with the bubble strategy, which is where they still had classes, and they still had classes in school and work, but classes and workplaces were divided into these units, so there wasn't interaction between different classes and units. And they've had, one of the biggest contributions Iceland has made is their comprehensive research. For example, of the people they tested, about 50% of those people were asymptomatic carriers, or 50% of those people who tested positive were asymptomatic, while the US is reporting that those tested, only 25% are asymptomatic. So that gap is worrying, because it suggests that there could be people in the US who are positive for COVID, but are asymptomatic and don't know it. Here are, again, some good graphs. Here's the number of testing that was being done. This shows the way that the disease was spread. You see in the beginning, these purple bars are for travel, and then you see this orange bars and these gray bars come in with family and more social, more person-to-person contact. You see here the number of cases that happened. You see in the beginning purple, and then they had bigger amounts, they had more amounts of cases later on, more amounts of daily cases that were from family contact. Oh, here, I'll get this out of your way. And the gray is unknown. And then here's the total number of cases they've seen to this day. The blue is the active number of cases, and the orange is the total number of cases. You see it's leveled off here, and the number of active cases has gone down significantly. And so vulnerable populations, they noticed that adolescents, adults, and males were more likely to test positive. Women and children were less likely to test positive, but when they did, the symptoms tended to be less severe. In targeted testing, so this is people who were already at high risk, about 16% of males tested positive, while only about 11% of women tested positive. So this isn't significant of the representative of the general population. This is the people who were in the targeted testing in the beginning. And also in the beginning, the people who tested positive, about 86% of them had visited areas that were high risk. And then over time, they saw a general shift of increase of cases among the elderly, but because they were able to control the disease so much, we see that Iceland didn't have as many cases in the elderly as we're seeing in other countries. So this is the age distribution, again, among adolescents and middle-aged people. Deaths, though, you see these gray bars, they were more significant among the elderly, though we do see one little gray bar here in the 30 to 39 age range. So Iceland's response and equitability, I would say from what I've researched, they had a very equitable response. There was very little evidence of disparities in combating this particular emergency. COVID testing is free, and they have a universal healthcare system, which makes healthcare costs much more manageable for those with lower socioeconomic status, which is an issue in the United States because in the beginning, our testing wasn't free, and still hospital bills can build up a lot of debt for people, and that is particularly hard-hitting on people with lower socioeconomic status. Yeah, and that is all that I really have to say. Iceland did a very good job in controlling the spread of this disease, and here are my sources. And we hope that their research will be useful to stopping the spread of COVID in the world. Thank you so much. Y'all have a good day.